The next session is entitled Challenges in Screening, Access to Care and Treatment. It's time to reduce the inequalities in Europe. And the first speaker is going to be the president of the European Liver Patient Association, Mr. Marko Kuronjak, but he's also the president of the Slovenian Associations of Patients with Viral Hepatitis, Slovenia HEP. The title of his presentation is going to be very challenging, Europe divided to the east and to the west. So, Mr. Kuronjak, the floor is yours, please.
Thank you very much, Professor Matičić, for the floor. I should stress at the beginning of this talk a big thank you to Professor Matičić and her extraordinary engagement that this event is under the Slovenian presidency to EU. And I'm extremely happy to be right after the presentation from France, from Pierre Nahon, because the next president country will be France. So I'm looking forward to repeat this kind of event in France in next year. So yes, my talk is very challenging, very demanding, east, west, south, divided. There were a few things already said about division, so I will try to focus on the things that were not said and just go through things very quickly that were already addressed by distinguished speakers. So next slide. Just a short summary. So I will just present shortly who the patients are and what we do. Then we need to say something about the coronavirus response and the liver cancer patients' expectations regarding the coronavirus fight. And then we will go to some recommendations or things that we see it are important to include in the initiatives to better do the screening and testing and finding out patients who have liver cancer. So European Liver Patient Association is from 31 representatives from 25 countries in Europe. And we work very hard to provide help to patient organizations from different countries. Next slide, please. From different countries that are part of our organization. And this includes also liver cancer patients. Next slide, please. So with the communication with the medical field, we are currently involved in 10 different medical research projects, and you can see the logos here. And it's important to note that European Commission has said several years ago that end-of-the-line consumer or patient communities should be included into medical research projects for the increasement of the quality of the project, but also for the information to the general public, what is happening in this field and what are the advances in medical field that are beneficial to the patient communities. Next slide, please. So all of these projects are funded by European Commission. Next slide, please. So what have been seen from the patient community or the representatives of patients in European Union? So we saw a response from European Union that was devoted to the corona crisis that we are a part of now. So there were a few steps in this response that I want to mention now because they have a direct influence of the position of patients with liver cancer in Europe and how do we see it and what do we think it's an important part. Next slide, please. So one part of the response of European Union is to develop a new digital executive agency. And one part of the notion was that this executive agency will be helpful to rebuild a post-COVID-19 Europe. And from patient communities, we would like to be included in this process. We would like to be part of it. So one part we are already with the inclusion in the Horizon 2020 projects, but on the notion of inclusion, I should stress that, for example, European Medicine Agency has a special way of communicating with patient communities, and we want to see this happening also in this new European Health and Digital Executive Agency. Next slide, please. The second part that we saw is the notion of creating the European Health Emergency Preparedness and Response Authority. We do say as a patient community that this is important and it's a great step in the right direction. The COVID-19 crisis has also shown us the lack of trust in the work of European institutions. So we do think that if you include better patient communities or general public in the communication on developing communication strategies of these agencies, you will also increase the trust in these initiatives that are extremely important and really step into the right direction. Next slide, please. So we saw also that the European Commission has presented proposal for expansion and reinforcement of ECDC mandate. So everything that was proposed is here on this busy slide, and I will not go into the details. I would like just to add something that is not there. So from the general public or from the patient communities, we think that ECDC should have a stronger role in advocacy level on the region and in advocacy level on a special communication in the national authorities. So we see this EU task force that will be assisting local response in member states as an important part, and we wish that the advocacy level of ECDC mandate here would be higher and would be also with direct communication to patient communities. Next slide, please. In a nutshell, so we think that we can better fight misinformation if we work closely together and if we try to develop communication strategies together with the new developed agencies and initiatives from European institutions. We need to try to work together because we expect that after this COVID-19 crisis, we will see the increase in number of patients, especially patients with problems with liver. Next slide, please. So we were addressing this several times today. So we have an elephant in the room, and the elephant is called the health inequities in the European Union. It does matter if you are a patient or liver cancer patient in Portugal or in Spain or in Germany or in Romania. You have different access to different parts of the healthcare. And together, I think that we will be working together to minimize this disparity. And we are looking forward to the solutions that we will bring to the table. Maybe next slide. So this will be my last slide. So the important three things that we think are important. So increasing funding for patient associations, patient networks in European Union, not just a specific funding for a specific cause, but to develop better networks of patients in European Union. So of course, we want to be also involved in communication with general public, where we think that with that, we will raise the trust to the European institutions and its work. And for the reshaping of European institutions, we would like to see patient engagement any way possible. The good examples are European Medicine Agency and also European Commission. And that would be all from my side. Thank you very much.
Thank you very much, Mr. Koreniak, for sharing with us the observations and the role of the patient organization in this field. And I'm sure that it's going to be discussed on our final discussion. And now I'm inviting the next patient voice. This is going to be Mr. Milan Miškovići, who is the founder of the Liver Center of Bitola, North Macedonia, and he currently serves as the organization's vice president and CEO. And Mr. Miškovići is going to talk about the example from North Macedonia. Please, the floor is yours.
Thank you very much, Dr. Mojca. I'd like to thank to all of you for the extraordinary work which you've done, especially for today. And this is amazing event where I can also the small one, middle income traditional countries, to say a couple of words and the experience to share with all of our audience. Next slide, please. On the beginning, we'll say a couple of words about us, who we are, where we are. Hepar Centar Bitola is a patient association that celebrates its 10 years of existence. We are established to help raise awareness of infectious viruses and non-communicable liver diseases, especially hepatitis, NASH, NAFLD, obesity, alcohol use, and liver cancer. Hepar Centar Bitola aims to educate about and prevent liver diseases in different groups like youths, at-risk groups, and the general population. We're offering different kind of testing, screening, and counseling. We like to promote new solutions, different approaches for liver diseases, to protect the patient rights, to fight against discrimination, marginalization, and stigmatization in the same time. This is our main goals. Please, next slide. We see one interesting slide with pictures from idea to realization. I must tell you that when started the campaign about EU Cancer Plan, we have a couple of brainstormings with our president in European Liver Patient Association and some of the members how to proceed with this issue on the national levels. And we got one excellent idea how to proceed in my country, who is not still part of the European Union, but we are applicant and we trying to approach the European Union, but need to have some bigger or small changes in a lot of fields, also in the health. Please, the other slide. First step from our brainstorming with ELPA president and some of our members was how to gather all the relevant stakeholders in North Macedonia in one place, in one table, and to see what kind of challenges we have in this moment. We know that in the last 2 years, it has been a big challenge to organize any activities during the COVID-19, but our main goal was clear, and we put a special emphasis on the rooting all parties and stakeholders to get special attention for liver cancer as one of the proof of concept disease areas where personalized medicine and centricity for the patient will be explored. How did we do this when we know that the all health system in Europe and also ours in North Macedonia has shifted its capacity to COVID-19? We have several options. The first option was how we managed to have success was to the fact that the latest data on liver cancer, which coming out from GloboCan, was let's say very bad for us and for all community, and show that mortality has climbed to a height of place in the world, and that the biggest risk factors are chronic hepatitis B and C, NASH, obesity, and excessive alcohol consumption. Second option was the launch of the European Cancer Plan. We dedicated to change the approach this year and to prepare the first national declaration on liver cancer. Hepar Centar and ELPA managed to find a way through lobbying with the multiple stakeholders to assemble coordinated body working group with coordinators from all relevant health stakeholders, particularly from the clinics. I must say that the gastroenterology clinic was one of the leading clinics which support this initiative, and the main coordinator coming from this clinic, that is the director of gastroenterology. And the third part was an option how to bring and how to invite the Ministry of Health and all other relevant institutions like head into insurance fund, who give of course the possibility to fundraise about the program who will next be on our agenda. Next slide, please. And after all our engagement together in all the important stakeholders in my country, we have organized 15 online meetings and 3 face-to-face meetings dedicated on the first national declaration on liver cancer from the beginning of May till the end of July, with the directors of the different clinics in my country. As a conclusion from the numerous virtual conferences, discussion and technical consultation, all participants from Republic of North Macedonia work on the first national declaration for personalized approach in the fight against liver cancer in its prevention, diagnosis, and treatment. This declaration is very important because we are calling our government in the Republic of North Macedonia, Ministry of Health, Health Insurance Fund, and all the affected parties to develop a full-funded national program that will be implemented through the partnership between all relevant entities and affected parties about in health and wider social context. I should be led by the European Commission and Parliament's development legislations and its health program, which expected to provide so-called wind in the back in the preparation of the dealing with the serious health threats and improvements in the fast recovery of the health systems too. Next slide, please. On this slide, you can see the signing of the declaration, all involved parties, and I must say that I have big gratitude also for the General Director of WHO Europe, Dr. Hans Kugel, who support us. This declaration was launched on the World Hepatitis Day, and I must said that Dr. Hans Kugel's, particularly the past 2 years, is somehow like a wind on the back on our activities and initiatives in North Macedonia. Next slide, please. Also, in the same time, we have excellent promotion about the declaration to reach more audience, of course, to have let's say, introduction to the general population in our country and all interesting parties to understand what we are trying to do. And we have a lot of media and online events, which ELPA president and WHO office in Skopje help a lot in this process, and also the directors and the clinics in my country who are deeply involved in whole the process. What was the big surprise for us was mentioned that we like to involve a lot of people from every kind of fields, not just medical experts. We got enormous support, I must tell you, that from our celebrities from our country. We have celebrities who, let's say, spread the patient voice among all necessary groups, especially to the policy decision makers. They make a lot of interesting events, even in time with COVID-19, which give us enormous support. And this support was somehow raised on the national level to introduce all necessary stakeholders. Next slide. Finally, my last slide, I'd like to tell you that from our initiative, for the first time, we have a multidisciplinary approach in our country for patients. Need for care of most of the patients in the integrated multidisciplinary center. One of our desires from patient perspective was to open a special center for liver disease, a liver center within the clinic of gastroenterohepatology, which is now in the process of opening. I'm so grateful to our clinic and the main coordinator of the declaration. In the same time, we like to tell you that we started a study for early detection with our partners from Europe who support and give us some kind of donation for this study. And this study is starting in next Monday, I think. And what is most important, the declaration needs the most important stakeholders, collaborators and parties from all levels. The declaration started by strengthening the political leadership in our country. They engage young people and patient organizations to galvanize grassroots movements, fast implementation of the WHO, EU, and scientific guidelines, which is necessary for this occasion, determination in dealing with the cross-border health threats, providing access to the necessary medication by making them available to everyone, especially need for personalized medicine, strengthening the national health system, digitalization, which is a huge, let's say, step and challenge for all of us, implementation of new methodology for monitoring and surveillance, implementation of national awareness plan, early detection, prevention, diagnosis, and treatment. And what is very important for us is the patient centricity, putting the patient on the first place, in open and sustained engagement on the patient to respectful and compassionate achieve the best experience and outcomes for them and their family. And what is interesting, there is no stigma, I must tell you, when we're speaking opening a special center for liver disease in my country. Why is that? Because all these patients with liver problems is going to be in one place, even the patient with the communicable disease like hepatitis B and C, which the stigma is, let's say, 100% is going to be less than last 2 years, because we are coming from the small, traditional, low middle income country. And that is our main goals. Thank you very much for your attention, and I hope so that you will have some questions.